how can um, the relationship from patient to provider be enhanced so that we can change the culture, which will lead to us changing the community, and more importantly, start to reduce these chronic diseases that are affecting people of color as it pertains to COVID.
I think that just I want to hang back to the previous conversation a little bit. Dr. O pointed out some very important things about how the things are stacked against the community. But then I think Chanel came in and really um, put the other side to it, which is to say, yeah, you know, things are stacked against you, but you make the choices, and so I think what people have to begin to understand, and where the education it becomes important, is helping people to understand more about what the healthy choices are, and that's what we're trying to promote with Life Cheer. You raise an interesting point, Andrew, which is there's another aspect to this where people actually go to the doctor, but then maybe they're not really getting the best out of the interaction. And I've been thinking about this a lot recently, and I've been thinking about the conversations I've had with some of my patients over the years. And what I would say to people is, when you go to the doctor, ask more questions. Just ask a question and let it hang there, and let the doctor address it, let him address it. Really, um, come in with questions about whatever it is that is bothering you. Um, Put the question out there, and let the doctor be engaged with you. I think a lot of times people sort of coming to the doctor's office and they expect to be talked to or talked at, and so they sit there and they listen to whatever you have to say, and they nod obeyingly, as you know, Dr. O, and they leave, but maybe they haven't gotten really the best interaction out of it. So there's a lot that we can do on the physician side, and that we need to do, and we all know that we have a lot to learn about how we communicate with different groups of people, and to do it better. But on the patient end, going back to what Chanel said, you can do for yourself as well. So I'd like to encourage people when they go to the doctor to ask more questions. I can't tell you how many times, Andrew, I've had a patient come to me and they're asking me about something that's not in my area, and I said, well, did you ask the other doctor about that? And they said, well, they didn't think to do that. So I would just encourage people in their interactions with physicians to try to ask more questions to get more information.
Yeah, I would echo that. I think that that is a wonderful point. I remember, I'm just going to bring up a little story. When I was in college, I was one of the only Black people in my class, and I used to be so afraid to ask a question. I didn't know how my teachers were going to look at me, and I was really fortunate that I had one Black professor who pulled me to the side, and she was like, why don't you ask questions? And I said, oh, I think my questions are dumb. I don't know how the professors are going to look at me or think about me if I ask them. And she told me all these other people in these classes, all the other maybe non-Black people around you that you think their questions are so brilliant, their questions, I'm telling you, their questions are nothing brilliant. The difference is they believe they have a right to be there, and so do you. And she challenged me to believe in terms of my education, and I would reflect this about your health, that when you're in your doctor's office, that they actually work for you, and that you have a right to ask whatever question that you want and to get everything out of the encounter. And so I just wanted to echo that fact. And sometimes it can be really intimidating. And so I'll say the flip side of that is you also, as much as I know that everybody doesn't have the ability to do this, but if you do, and you're in a situation where you don't feel comfortable, that you can't really step into that role where you feel empowered and that it's your right to ask questions, then you should find somebody that you have a relationship or can build a relationship with, in which you do have that, where you feel like you can be open and honest. because as Dr. Morgan knows, the more information that I think that we have as doctors, the better we're able to help people get to their ultimate goal, right? Which is again that health and that wellness and that abundance. So I was just putting that up. Yeah, I was, I was just going to kind of uh, piggyback off of that point and just say one last thing. As
Mhm.
an educator, as a physician, I'll say that if you don't understand something that your doctor or your provider is telling you, uh, it's actually on them. That's how I feel. It's on me, the doctor, to figure out a better way to explain it. It's not on you for not asking the right questions. So I just want to continue to put that out there to encourage people to ask questions. And if you're not reaching a level of understanding, it has nothing to do with you. It just means that maybe we need to figure out a better way to explain things and break things down. So that's what I'm always challenged with when a patient says, I still don't understand. I said, you know what? I need to learn to do a better job of explaining that, don't I?